There are several children we have termed dullards. They are unintelligent, and they had repeated classes again and again. Over the years, we have come to realize that some of those children actually have what we call refractive error, meaning that they cannot see very far or they cannot see what is close to them, and they need a pair of glasses to be able to function normally. But because they are not detected, many destinies have thus been destroyed. Today we are going to be looking at a group of diseases we call refractive error. These are diseases in the eye that need glasses for somebody to be able to see very, very well. You're welcome to this edition of Sight Ed, a sight education program designed specifically to enlighten every one of us about eye health issues. Don't forget, we want to keep receiving your questions and comments through all our social media, and we will soon respond to some of them again as the time permits. Today, we have another specialist in the house. He's a consultant ophthalmologist. He's also a professor of ophthalmology, Professor Ernest Omotie. So I hand you over to him. Please listen attentively to this segment of the interview. Thank you very much.
My name is Afekide Ernest Omotie. I'm here to talk to you about a very common, one of the most common conditions affecting the eye that makes people seek from treatment from eye specialists or eye doctors. This condition is what we refer to as refractive errors. Normally, the eye is supposed to see objects or things that are far away clearly, and that happens because the rays of light that come from those objects focus on anybody's retina. Retina is a part of the eye inside that makes you to see what you are supposed to see. However, sometimes this light coming from anything you are seeing will not focus on that sensitive part of the eye called the retina. When that happens, what you are seeing becomes blurred, and that's what we refer to as refractive error. There are different types. The common ones which people talk about, one would be what they call myopia. Myopia simply means short-sightedness. What happens is that the people see objects or things that are very near them clearly, but things that are far, they do not see clearly. The other one is hypermetropia, or some people abbreviate it hyperopia. In that condition, some people refer to it as long-sightedness. In truth, it is not really long-sightedness, because people that have hypermetropia do not even see distant objects very clearly compared to people who are normal. Such normal people who see everything clearly are said to be emmetropic. So these hypermetropic patients need to make additional effort from their eye muscles, which we call accommodation, to see objects whether they are far or whether they are near. Those are the people that we refer to as hypermetropia. Then there's another condition which we call astigmatism. In that condition, the surfaces of the eye that bring what you are seeing, the image of what you are seeing, to a focus on the retina. That's what you are seeing, brings them so that the retina can see them clearly. The curvature is different in different meridians. So the front of the eye, the cornea, or the lens may be contributing to causing astigmatism. In that kind of condition, depending on the amount of that astigmatism, the child may be able to see fairly well or may not see well at all. But in all cases, the child is making so much effort to see clearly. So particularly when this astigmatism is mild. So they begin to complain of headache, tearing of your eye, bringing out tears, itching, and all sorts of things like that. For the sake of completion, I will just mention one additional problem, which is not necessarily by definition a refractive error, but It refers to conditions where people, because they are getting older, now require to use glasses to focus on near objects, particularly for reading. That condition is called presbyopia. It is due to loss of that accommodative effort with age, and it frequently starts anywhere from about 40, either plus or minus a few years and above. And you commonly see those people using glasses that have two segments or more. You see a small segment under for seeing near objects and far objects. They can either use the ordinary eyes or the correction for it. Now, this condition is particularly important because many of our children are born with some amount of refractive error, but the child has the ability to accommodate and compensate, but sometimes they are not able to compensate. And so you hear of children who go to school and they cannot see the blackboard well, or they are missing lines as they are writing and things like that. One big problem we have is that many parents will conclude that they don't want their child using glasses. But that is a very dangerous thing, because they think that when you wear the glass will make the eye worse. That is one group of people. But the truth is that you need to correct such refractive errors that are significant in children, because if you do not do that, it will cause further problems. The eye becomes lazy. We call that condition amblyopia. So that even after you've left the child to become an adult and you now say, okay, now you want to correct that refractive error, the child will never really be able to see very clearly again. So it is important that every young child, before they start school, are screened by an eye doctor, so that they will check to make sure that there is no problem with their refractive ability, so that they can be corrected quickly. Now, there are different ways by which we correct these errors. The common one is to use glasses, spectacles. They can be plastic, they can be glass. Some people may use contact lenses. These are lenses that small lenses that you wear in opposition to the eye. You wear it directly on the surface of the eyes, and nobody will know that you are wearing any lenses, because the contact lenses are on the surface of the eye, specifically on top of the cornea. There are even people now who don't have refractive errors, but they wear what they call cosmetic contact lenses. So it's something that's common. You see black people with blue eyes and gray eyes. It's because they are wearing contact lenses that give them such colors. So they can be worn for cosmetic reasons as well as for these refractive errors. But there are surgeries, laser surgeries in particular, that can also be performed to reshapen the surface of the eye and correct such refractive errors. Such surgeries are quite expensive because of the machines that are required to do them. So they are not readily available. But they are already available even in the country. But they are not commonly available. So the common ways to correct our errors will be the use of spectacles, which we call glasses, or use of contact lenses. So specifically, we need to correct these errors to prevent further problems as soon as possible. Let's even look at the social life of the child. A child that maybe cannot see far, and then you deprive the child of correction. What you have done is that the child's academic performance may even drop, because he doesn't see the board clearly and probably has to be copying from his mates all the time. And you will now think that there's something wrong with the child. Why is he copying? He should be seeing the blackboard by himself. And in classes, maybe the teachers will not be bringing them to the front, come and sit in front. And even then, they still keep struggling. It's better to allow your child to wear his correction so that he can participate fully in all activities, including sporting activities. In such cases, you expect the child to wear plastic lenses, so when they are involved in any outdoor activities, they can see everything happening around them. I remember very clearly, there are even people who have become adults. They are short-sighted. They only see from here to maybe like 5 or 6 meters away clearly. Beyond that, they don't see well. And they get to adulthood, they're thinking that they're seeing very well. And they start driving cars, and they don't know that they can't even see anything beyond a short distance. It is very important that these presbyopic patients get their eyes properly tested before they take glasses. Now, these people are adults. So what some people do is that they just go to any place, collect any pair of glasses in a market and just test which one can they read with, or sometimes borrow somebody's own and check and see which one they read with, and they can read with it. That is wrong. Because one, apart from the fact that you will get the wrong pair of glasses and then you will cause strain on your eyes, headache, and other problems that will come through. It is important an eye specialist looks at your eye, because that age, about 40, is the critical age at which other diseases start to appear in the eye. Diseases that can get you blind. For example, glaucoma, the condition that is silent, the silent sneak thief of your sight, starts around that age. So by testing you for the glass at that time, they also check your eye to make sure you don't have glaucoma. Because glaucoma is something that will not tell you that is blinding you. Then one day you just wake up and discover that you are practically blind. Other conditions like people that have diabetes, sometimes they're even picked from examining the eye. Hypertension can be picked from examining the eye. And it's a set of other conditions. And they all tend to start at about that age. So it is very important that you have your eye tested by a specialist when you start having problems with reading, rather than just going to buy any spectacles you find anywhere else in the open market and things like that. It doesn't cost so much to see an eye specialist. It's also very important too that we dispel some things that people think. Apart from the fact that some people think that people are too small or too young to wear glasses, there is no age at which you are too young to wear glasses. Even a newborn baby can wear glasses. There's nothing about it. Everybody can wear glasses, as long as it makes you see clearer. In fact, there are conditions in the eye caused by refractive error, which can result in misalignment of your eyes, what people call squint, which some people call half-past 4 eye or half-past something eye. Well, the two eyes, and one eye is looking one way, the other eye is looking the other way. Some of them start in very early childhood, even before the child is 6 months. And you may discover that all the child needs to make the eye straight is just to wear the correct pair of spectacles, correct pair of glasses, and the eyes will be straight, rather than being burdened by having the unsightly appearance of that squint. Very important. It's important to know that there are things people spread about wearing glasses that discourage people from wearing glasses. They will tell you that your eyes are becoming bigger, smaller, or becoming deeper. All these things cannot be true. Wearing something in front of your eye cannot change the way your eye is. It is true that the lens you are wearing has power. Either it will increase the size of something when you look through it, or it decreases the size. That is the lens you use to correct the eye. The eye only appears that way when you look at the eye through that lens that he's wearing. When he takes the lens off, the eye returns back to where it was. So the eye remains the same thing. If I don't mind returning back, because the eye never changed in the first place. It is just the way it appears through the lens. And I know some people, because some people may wear their lenses continuously, they don't take it off. When they take it off, they suddenly look different. But all that do not mean anything, because the lens you are wearing outside cannot change the way your eye really is. The refractive error of the eye tends to change with age. Give an example. When the child is born and is much smaller, and the eye is small, the child has hypermetropia. This is what people call long-sightedness. But as he's growing older and the eye is getting bigger, that error starts to reduce. And eventually, the error might, depending on the amount of error that the child started with, that error might be eliminated and the child becomes emmetropic. That's normal sight. Or it may even go beyond it and move from hypermetropia to myopia, depending on circumstances. And if the child was myopic at an early age, as the eye is getting bigger, the myopia will even get worse. So it's not the glasses that you are wearing that make. So if you see a child, for example, who was wearing glasses at one time or the other, and the vision is getting worse and it needs higher and higher powers, it's not the glass that made his eye worse. It is the fact that the eye is growing, the error is increasing, and it requires higher power. Same thing with presbyopia. The person is reading with glasses today, maybe +1 today. Tomorrow, and maybe in a few years' time, this guy is now +1.5, and then another 5 years, another +2. It's not because the glass is making his eyes bad. It is because with age, the amount of accommodation is getting less, and he requires a higher power to focus for near. That is the reason why. It is not because the glass caused any problem. Well, those who are using glass may want to argue one point with me, that when they've worn the glass for some time, they can no longer say what they were saying before. Yes, it's possible, because your eye is now relaxed. It will take a little time for the eye to start training itself to get back to where it was before. But it's only achieving that because it is training itself to achieve it. So the eye should be able to see things clearly with comfort, not with strain. So I advise everybody who has any problem with sight that requires spectacles or contact lenses to please get the appropriate correction for this refractive error, so as to avoid other problems that will arise and improve their quality of life. Because if you don't, you will be losing a lot. Or many of the things people say to discourage you from getting glasses, either for your children or for those who are adults, are not true. You can as well say that if you are slim, wear clothes that are very loose and you will go fat. Or if you are fat, wear clothes that are very tight, then you will go slimmer. Nothing will happen. The glass is outside your body, so it cannot change you. That is the truth. So people should feel free. Wear your glasses and make sure you meet a specialist to check your eye, because every eye doctor that checks your eye at the time you are getting your glasses also checks for other diseases peculiar to that age, and that may be what will prevent you from going blind. And sometimes they will detect a disease that could be life-threatening, and they prevent you from losing your life. If you have hypertension, you may never know. It may just be that doctor who examines your eye when he was giving you glasses that noted for the first time that there are hypertensive changes in your eye. Let's test your eye, test your blood pressure. Or there are changes that are due to diabetes. Let's test your blood sugar, and then they will discover that you have diabetes. And that is life-saving in itself. So please try to get your eye properly tested early enough and get the appropriate correction by an appropriately trained eye doctor. Thank you.
All right, viewers, I'm sure you've heard it all from Professor Ernest Omoti, talking on refractive error and how we can manage those conditions. I do hope most of our questions have been answered as it relates to glasses. Several times parents come and they say, no, this baby is too small to use glasses. That decision should only come from an eye care specialist, because we want the children to grow normally, and they need to have good eyesight to be able to develop and to function optimally. Good day, viewers, and welcome to this special edition of Sight Ed. It's a special edition because today we will be talking about the commonest cause of blindness all over the world. And that cause of blindness is cataract. And it's also a special edition because we will be starting another movie, also an eye health movie, titled You Are My Eye. And coincidentally, You Are My Eye is also premised on the disease cataract. So you're once again welcome to Sight Ed, the sight educational program designed to enlighten me and you so that we can enjoy good vision. Today we have also interviewed a specialist, a consultant ophthalmologist on the disease cataract. So he will be talking to us about what is cataract, what are the causes of cataract, and along the line as he talks to us, we will be able to understand some myths, some misconceptions about this disease called cataract and its treatment. So today we will be listening to Dr. Aribaba Temitayo Oluwafisayo. He will be discussing the disease cataract.
I'm Dr. Olufisayo Temitayo Aribaba. I'm a consultant ophthalmologist with the Lagos University Teaching Hospital and a senior lecturer with the College of Medicine, University of Lagos. My task today is to discuss cataract, which is the commonest cause of blindness all over the world, more so in Nigeria, where it accounts for almost 50% of the causes of blindness in this country, following the National Blindness Survey. Cataract is the opacification of the human crystalline lens. Every human being has a lens that is transparent. But when that lens becomes opaque, then we have cataract. The opacity can occur at birth, that is in utero, when the baby is inside the mother, or it can occur as the child is growing. We call it developmental cataract. But mostly we see cataract in the elderly, which we call age-related cataract. When patients develop cataract, the ideal thing is for them to come to the hospital where they can see doctors and they can have necessary surgery, and sometimes glasses may help, but mainly surgery, so that when they come, they have the appropriate surgery and they gain back their vision in no time. Cataract surgery is the most cost-effective intervention known to mankind surgically. It is comparable to oral polio vaccine, to other immunization. It's comparable to vitamin A distribution and supplementation. There's no surgical intervention known to mankind that can be compared to cataract surgery. But the major problem we have has to do with barriers to uptake of cataract services. Sometimes government sponsors surgeries, but patients may not turn up because of fear, sometimes because of distance, sometimes because of the cost. But even when it is free, sometimes patients will not turn out because they are afraid of the outcome. When we were much younger, I remember our elders would prevent us from playing the Ayo game, especially towards evening, believing that when you play Ayo game late into the night, that as children, when we grow up, we will develop cataract. And then they will advise us that we should pick the seeds and use it to touch our lids before playing the game. And that's the ritual all of us follow, so that we won't develop cataract, because it's believed that it is the seeds that shows up inside the pupil, and that's what is responsible for the whitish reflection that people see when adults develop cataract. Cataract, number one and most important cause of cataract is aging. As we go older, as we develop gray hair, people tend to develop cataract. And it's like what you see when you pour garri inside water and then it swells up, or you drop a slice of bread inside water and it swells up. The same things happen to the protein inside the lens. As with time goes on, it swells, and as it swells, it becomes whitish, and that is how cataract develops due to aging. The other cause of cataract is some patients with diabetes mellitus, for example. Patients with diabetes mellitus that is not well controlled may develop cataract even before the age of 40, especially if they have poor control diabetes. The other important cause of cataract will include trauma. It's not impossible for people to sustain injury, and following an injury, there's always a scar. For the eye, one of the scars that we see is cataract, and it's so easy to see that scar. So trauma, injury to the eye can lead to cataract. Even though the injury might have occurred many years ago, but often than not, the telltale signs will always be there. That's why when people sustain injury, it's better that the injury is well managed and the patient report to the hospital on time, not for the present, but because for the future. Because 10, 20 years later, that injured eye may develop cataract. The other cause will include drugs. Patients that are on steroid, patients that are on some other tablets that, of course, can lead to cataract formation. And there are many of them, from patients on prednisolone, patients who are using cream because of skin rashes, patients who are on tablets like allopurinol, chlorpromazine, all those tablets can lead to cataract. For children, when mothers, pregnant women, when they are exposed to some infection, what we call infections like toxoplasmosis, rubella, syphilis, CMV retinitis, herpes simplex. Once the baby is delivered, the baby, apart from other problems, may develop cataract. So pregnant women need to be taken care of, and of course, they need to go to antenatal clinic to make sure that the baby and the mother is good, so that when they deliver their babies, the babies will not develop cataract from birth. Most times, patients with cataract, we notice a gradual reduction in their vision, as if there's an harmattan haze, as if there's a cloud. Majority of the patients, when they wake up in the morning, very early in the morning, the vision is good. But as the sun comes up, the vision sometimes will reduce. And they start wondering what was happening. Then towards evening, also the vision is good. But if a car is coming, of course, they go blind again. Such patients will develop what we call posterior subcapsular cataract, which causes a lot of glare and a lot of discomforting effects. And most of the time, patients are usually unhappy. Such patients may not be able to read very well, may not be able to look at things that is close, and they are happy when there is no sun. Other signs for cataract is some people may be able to read without their glasses, but that's for a short time. And the reason for that is that the part of the lens that is affected will allow them to be able to read. And such patients, even though they are very few, they are happy because they can throw away their reading glasses. The reason for the poor outcome may be other systemic problem, what we call systemic comorbidities like hypertension, diabetes, hypercholesterolemia, too much cholesterol. If all these other diseases are not well controlled and patient comes for cataract surgery, often than not, the result may not be good. Sometimes it may be that the patient already had issues with that particular eye, like glaucoma. If there's a glaucoma coexisting with cataract, of course, the result of cataract surgery will not be as perfect as it should be. But sometimes, some of the patients are on drops that are not prescribed by medical doctors. And some of these drops tampered with the structures within the eye. And so, when the surgeon inadvertently opened the eye, of course, the surgeon will be embarrassed. Because, for example, the zonals or the support inside the eye has been eaten up by the eye drops that the patient has been using. And so there are several reasons why patient has poor outcome. But the most important thing is that a lot of people, even in Nigeria, are benefiting from modern cataract surgeries, and they are happy, they are driving, their quality of life has improved following this simple procedure. Following the procedure, most times the patient will need refraction, they will need glasses. And it's not the thick glasses that they used to use. It's usually the standard glasses that everybody is using. It won't be as thick as the one that they used to use. But apart from that, before patients come for surgery, we want them to stop some medications. Most importantly, a lot of people above the age of 40, 50 that are hypertensive are on aspirin. Aspirin tablet is good. It thins the blood. It prevents blood clots. Prevents them from having stroke. But if a patient is on aspirin and the patient comes for surgery, that patient will continue to bleed during the surgery, and the surgeon may not be able to see the operating field. So we always advise that patients should stop using aspirin that they use once a day. It may be vasoprene, it may be discipline. They should use it. They should stop at least 2 weeks before the surgery. Then after the surgery, when the surgery is over, a day or two after the surgery, the patient can continue with his or her discipline. The other drugs is the drugs used by men for prostate. Those who have prostatic enlargement are on some set of tablets. When patients use these tablets, the iris misbehave. And the iris is a structure part of the uvea inside the eye. And once you open the eye and you see the iris misbehaving, we call it floppy iris syndrome. It's really embarrassing. And that itself can lead to bleeding. It can lead to poor surgical outcome. And it may lead to abandoning the surgery. Another important point is patients who have diabetes. Often than not, patients who are diabetic may have poor control all along. When they want to come to the hospital, that's when they remember, and that's when they start using their drugs. But what is important is not the diabetic control in the last 2-3 weeks. What is important is the diabetic control in the last 3 months or more. Because a lot of people will start watching their diet, they start using their drugs religiously, but when you check their current sugar, it may look normal or marginal. But when you do their glycosylated hemoglobin, you probably discover that their diabetic control has been bad. Because when you do the surgery, the eye may refuse to heal, and they may develop what we call anterior segment syndrome. Those are some of the reasons why people have poor outcome for following cataract surgery. Another reason is hypertension. When patients are badly hypertensive and they are not well controlled, on the operating table, they can develop what we call explosive hemorrhage, which is a disaster, is an embarrassment to the surgeon, and the patient may lose the eye because of the fact that the pressure difference inside the eye will be accentuated, and after an incision on the eye, there will be a sudden separation and there will be bleeding into the suprachoroidal space, and the whole of the anatomy of the eye will change, and of course the patient may lose that eye. And so most eye surgeons, ophthalmologists will insist that patient's blood pressure must be normal. If all these are in place and patient is well prepared, most times the result of cataract surgery is rewarding. Patient is happy, the surgeon is happy. Whereas in the case of glaucoma, it is garbage in, garbage out. If a patient comes to the hospital with advanced glaucoma, the result may not be good. But in cataract, most times the vision will improve if everything is okay. It's not impossible for patients who come in for cataract surgery to discover that their vision reduces after some time. That may be due to posterior capsule opacification, what we call secondary cataract. But that can be managed either by surgery or by simple laser surgery, which takes about 10 minutes on the table, on the street lamp. The laser light will cut through the opacity, which is on the posterior capsule, and the vision will improve drastically. We need to create more awareness, because in the community, as we are talking, we have these people who are not literate, though they may be very good in Arabic, but they didn't go to the Orthodox school, and they are busier than all of us call ophthalmologists or modern doctors, and we call them couchers. These are traditional surgeons that moves from houses to houses, from communities to communities, and they use sharp needles to push the lens into the vitreous. Patients will regain his or her vision, but the vision will not be perfect, and most times this patient will lose vision eventually, because the lens that has been pushed into the vitreous, which is at the back of the eye, will release lens protein that eventually will lead to the damage of the eye. Patient may develop secondary glaucoma. they develop a lot of problems like vitritis and what have you. And so we need to warn our relations, our friends, not to allow these barber surgeons to touch them. And it's not as if it's cheap. Apart from collecting money, they will collect animals from goat, from sheep, from cow, from them. And often than not, when the patient goes blind, they always blame it on the effect of witches and wizards. And so often than not, the patient will take the second eye to them. And of course, the same thing will happen again. And they are cautious, they are busy, they are well versed in Arabic, they can recite the whole of the Quran. And so a lot of people trust them, that they are godly people. But they are different from orthodox doctors in the sense that they are the ones that will carry their trade into the patient's bedroom and sitting room. They won't bring the patient most times to hospitals. So we need to be aware of that. A lot of patients believe that it's due to old age anyway, and that they've seen everything, and so they won't want to come forward. Some tied it up to attack, spiritual attack, as if they are being punished by God, that maybe they've committed one sin or the other, and that's why God is punishing them. And some other people probably believe that it's due to, maybe playing higher game when they were younger, and it's the effect, it's the seeds of the higher game that is in front of their eyes. But the easiest way to know is when you look at your partner's eyes or your friend's eye, and in the center you can see a white tissue reflex, especially in elderly patients, then it's likely to be cataract. Look inside the eye, and then in the center of the eye you see a white reflex, then it's likely to be cataract. And please encourage such people to go to the hospital, and they can have cataract surgery done. Even government, federal government, and most state governments are supporting subsidized and even free cataract surgery programs in hospitals all over the country. I will encourage and advise people to benefit from all these programs by government, by individuals and non-governmental organizations who are out there to try to assist us in reducing the cataract blindness in our society.
All right, so I have a question for every one of us as viewers. What is the local name in your own area for the disease cataract? We would like to hear from you. Send your response to our Facebook page, our Twitter, and Instagram. As we said earlier on, sometimes though, the Yoruba may call it Toro Oju. Well, and several other places have several names for this very common disease. But let me quickly tell you, if you look at the eye of your neighbor and where the black part should be, if you see anything whitish in that central part, it's likely to be cataract. That person needs to be brought to an eye hospital immediately.